Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time on a Wednesday, folks. This is episode 205 of the Everything Medicare Podcast. If you're not familiar with who I am, my name is Christian Brindle. I own and operate a little insurance agency, a little organization called Christian Brindle Insurance Services, located just outside of Salt Lake City, Utah. We work with people on their Medicare health plan in 10 different states. Those states are Utah, Idaho, Colorado, Oregon, Washington, California, Texas, Virginia, South Carolina, and Florida. And folks, we have access to all of the biggest name insurance carriers in the insurance industry. We've been at this podcast for a while now. Hence, having 205 episodes. I still can't believe that it's 205 episodes that we've reached, to be completely honest with you folks. And part of it is just because we have such a fantastic audience, and we have you to thank for that. But I digress. I do digress. Folks, thanks so much for being with me. Last couple of weeks, we had an episode come back on Monday, but the last couple of weeks before that, we had a little bit of a hiatus. My family and I took a little bit of a mini trip, and we're still in the office and working for part of that 2 weeks, but we, for the most part, were in a situation where I just needed a little bit of a breather from bringing you the show. This is kind of a grueling schedule combined with everything else we do at the office, but we're back. Like I said, if you're not familiar with the show, every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And we've talked a lot on this show and a lot on this platform about the infamous Medicare Advantage. For those of you who don't know, that is what Joe Namath is trying to sell you on commercials. That is what Joe's talking about. But we all know that Joe didn't really call the Medicare coverage hotline. Joe has a pension from the NFL that pays for a Medicare supplement for him. I believe I read that somewhere credible. All the advertisements you see for $0 premium plans. Wow, free dental, vision, hearing. And then you buy the plan, and it turns out the only dental you're really getting is preventative dental, cleanings, x-rays, exams. Now, don't get me wrong. Some programs can have a lot of dental, but they might not cover your doctor. One thing that we all need to understand about Medicare Advantage plans is they have a lot of different working parts, and there's some real dangers in picking them up, folks. There are some people out there that need to be on Medicare supplement plans. I've always said this, and I'll say it again. Both sides have their place. There's people that need to be on both sides of the spectrum, and both have positives and negatives. Every single time we take on a new client, especially if they're new to Medicare, I'm going to sit down with them and walk them through both sides of the coin. That's usually what my approach is. With a Medicare Advantage plan, you're running your Medicare through a private insurance company. Doctors commonly refer to them as replacement programs, although I'm not supposed to use that terminology. I think it's a good analogy. In a sense, they're taking the place of your Medicare. Medicare doesn't have to pay 80% of your medical bills any longer like it would if you had original Medicare Parts A and B. And that takes a big burden off of their shoulders, so in exchange, they agree to fund this private insurance company every month to take care of you. Because of this, a large portion, I should say, of Medicare Advantage plans through private insurance companies come at no extra premium. And if they do have a premium, commonly, you're going to be looking at a $20, $30, $40 a month premium. And they combine everything into one plan, your medical, your prescriptions. Most of them nowadays come with some kind of dental, vision, hearing, even if it's limited. And an array of extra benefits. They could come with gym memberships like Silver Sneakers. They could come with over-the-counter essentials, transportation benefits, and on and on and on and on. And they sound wonderful, don't they? But of course, as we all know, they have some gaping holes in terms of limitations. Something that I want to get to on this episode here today. I am against the people that say Medicare Advantage is no good, that say no one should be on Medicare Advantage. I don't agree with that. Is it more work for us to do as many Medicare Advantage plans for clients as we do? Yes. It's a lot more work for us. And I've explained that several times on this platform. I'm not going to get into that today. But I try to offer what I feel is best for my client that's sitting in front of me. And if it's a Medicare supplement, I want to do a Medicare supplement. If it's a Medicare Advantage, I want to do a Medicare Advantage. But I want them to at least be aware of both sides of the coin. And I think we've done a pretty good job of doing that on this platform, on this podcast, on this show, of presenting both sides of the argument in equal light. I've said multiple times that, in my opinion, I think if you can determine which way you'd rather go, Medicare Advantage or Medicare Supplement, you're taking 80% of the difficulty of making a decision out of the equation right there. Because everything you've ever heard about in terms of Medicare falls into one of these two categories. Everything. There's only two different ways you can go. Folks, I have to take a quick break. Don't go anywhere. I'll be right back after we hear from this week's sponsor, and I'll tell you what the real danger is in terms of picking a Medicare Advantage plan and things that you need to know about. Don't go anywhere. I'll be right back. Welcome back, everybody! Thanks for sticking with me through that quick sponsor break. Let's talk about Medicare Advantage. Let's have a conversation, just me and you. Any person that's listening right now, this is just a conversation between me and you. Let's talk about the facts. The facts are, with Medicare Advantage plan, is this. Let's talk about the pros and the cons. The pros, the way I see it, are the premiums are low. So if you're on a budget, like a lot of people that are retired are, you're living on Social Security, makes sense. It's nice to be able to not pay any extra premium of above and beyond Medicare. The Medicare Part B premium, for a lot of people, comes out of the Social Security check every month, $144.60 this year, as I talked to you in 2020. And potentially no more. And that's convenient for people. It's also convenient to have everything in one plan. You don't have to purchase your drug coverage separately. You don't have to purchase a separate dental, vision, hearing plan if the dental coverage is good enough. That obviously varies. And the medical coverage probably is better than a lot of work plans. Work plans are usually, not all the time, but usually going to have deductibles, at least a couple thousand, maybe 5,000, maybe even 8 to 10,000. I've seen some of those recently. Which basically means you have that amount of money that you have to meet for a majority of things, if not everything, before they'll cover anything. So you basically, if you have a $5,000 deductible, in a lot of cases, if you go to the hospital, you're going to be paying $5,000, 100% of the bill, up to $5,000 before the insurance helps at all! Before they help at all. And Medicare Advantage plans are in most cases. There are some with deductibles, but they're silly. Why would you buy a Medicare Advantage plan with a deductible on the medical side? There's a couple out there that I've seen. They make me roll my eyes. Typically, with most Medicare Advantage plans, you're going to be in a situation that you're paying a copay for the hospital. Might be $100 per day for the first 5 or 6 days. Might be $200, $300, $400 a day. But regardless, it's going to be a lot cheaper than a lot of insurances will charge you. It's pretty good. Depending on the market, depending on where you live, depending on the plan, depending on the insurance company. Right, we get that. But what do we need to know? I mean, with Medicare Advantage plans, we also know that there's networks. I'd put that in the negative category. There's networks of hospitals and doctors. The plans are ever changing from year to year, right? And there's potential for more out of pocket if you have something serious happen. my opinion, here's the real danger with picking a Medicare Advantage plan. The plan's benefits cannot change until open enrollment. They have to announce them October 1st, and they actually can't take effect on these changes until January 1st of the upcoming year. So the plan that you have right now is what it is. I'm not trying to be hip and talk like a younger generation or anything like that. It is what it is. No, the benefits literally are what they are until the end of the calendar year, and they cannot change at all until January 1st. So you're locked in, you know what you get, and if they do change in a way that doesn't fit your liking, you're able to change during open enrollment before the changes take effect, right? Sounds like no big deal. But what most people don't tell you are two things can change mid-year with Medicare Advantage plans. Now, do they happen commonly? No. So I'm not trying to paint the narrative or paint the picture that this happens all the time or frequently, but can they happen? Yes. And those two things are, they can change their provider network. Doctors can come in and out of network any time of the year. So you could sign up for a plan during open enrollment. Medicare Advantage plan, you're locked in for the entire calendar year, unless you have some kind of life-changing event, that is, which we've done episodes about that in the past. And your doctor could fall out of the network midway through the year, and you're stuck on the plan without your doctor. We've seen that happen. That's a danger. Anytime you're dealing with a network like that, that's a danger. And there's a million different reasons why a doctor could come out of the network. It could be the insurance, they're not following the insurance company's guidelines in terms of billing, whatever they require the doctors to do. Could be the doctors just feel like the insurance company is difficult to deal with. And trust me on this, I have people that call our office all the time and they're like, well, my doctor told me XYZ insurance company is hard to deal with and they're hard to bill and they're the worst. I've gotten that call with someone filling in the blank for any insurance company that's ever existed in the entire insurance industry. But you know why? It's because doctors are human beings and people just like you and me. And every doctor is going to have their own experience with a particular insurance company. If you look hard enough, you'll be able to find doctors' offices that trash any particular insurance company, no matter how respected. So that comes with the territory. I've heard doctors say bad things about every insurance company I've ever heard of ever in my entire career. Every insurance company we've ever worked with, certainly. Now, there's certain companies you hear these complaints about more than others, but certainly about every company at least a couple of times. And it's just because doctors have preferences and the way they like to do things, and not every insurance company kind of fits that mold, if you will. But the doctors can come in and out of network for any reason in the middle of the year. Like I said, it doesn't happen tremendously often, but it certainly can happen. The second thing about Medicare Advantage plans that can happen to you mid-year is if you decide you need to make some kind of life transition in the middle of the year. What I mean by that is, let's say you decide you want to move out of state to be closer to family, children, grandkids, whatever. You're going to have to basically repick your entire plan because Medicare Advantage plans are based on your specific state and service area that you live in. So if you move, you're going to have to change it. And that's kind of a convenience. You have to relearn all new plans and everything like that. But I think the main thing is that doctor thing coming in and out of network. Most people can handle that if they need to move. The other thing is, with Medicare Advantage plans, if something happens to you mid-year where you're diagnosed with something like cancer that requires chemotherapy treatment, or whether you do end up in a situation where you have kidney failure, end-stage renal disease, like I mentioned with Medicare Advantage plans, you're usually looking at a maximum out of pocket. It could be $3,000 depending on where you live. It could be $5,000, $6,000. The maximum it could be this year in network anyway is $6,700. That's what the Centers for Medicare and Medicaid Services have put a cap on it at this year. So $6,700, but might be less depending on where you live. But the thing is, with most Medicare Advantage plans, if you're getting dialysis, chemotherapy, most plans that I have seen will pay 80% of that bill and leave 20% behind for you to pay up to the max out of pocket, of course. So there's that safety blanket. If you ever hit the max out of pocket, they'll pay 100% of your medical bills for the remainder of the calendar year. But no matter how low or high your maximum out of pocket is, I would expect to hit that max out of pocket within a matter of a month or two with the expensive treatments of kidney dialysis or chemotherapy. So that's a huge risk if your health does take a turn for the worst in that regard. Now, you can always pick up a cancer policy to kind of remedy the cancer treatment. But it's a conversation that needs to be had, would you say? I would say so. Medicare Advantage plans are ever changing. There's more potential for out-of-pocket if your health takes a turn for the worse. That's basically the bottom line. That's where I'm going with this, folks. There's more unknown. Things can change. If you're not on top of it during open enrollment, which we're getting closer and closer to again, can't believe it. Seems like the last one just ended. But if you're not paying close attention to your plan, and if you have a good agent, they should be keeping you in the loop. But if you're not paying close attention to your plan, like I said, during open enrollment, your plan could change dramatically right under your feet and you wouldn't even know it. You could be taking a medication that costs you nothing or very close to nothing. The next year it could cost you a fortune because of a formulary change. Medicare Advantage plans are ever changing. There's a lot of unknowns in terms of if your health takes a turn for the worse, you're going to be left exposed a little bit more, quite a bit more, I'd say, actually, than Medicare supplements. And these are things that people need to know about. These are things that conversations need to be had about. Joe Namath's not going to tell you this. Joe Namath's going to read a script about something that he doesn't even own himself. I'd be willing to bet. I can't say definitively on that, but I'm willing to bet! Folks, I hope you enjoyed this episode. I hope you got something out of it. I hope you kind of get my message on this. Both sides have their place. Both sides are important. And people in this audience need to be on both sides of the coin. But you need to understand both sides of the coin to determine which side of the coin you fit on. Point blank. Folks, if you live in one of the 10 states that we're licensed to do business in, I'd love to talk with you. If you need help with your Medicare plan, if you're turning 65, whatever the case might be. Our office number is 801-255-5340, 801-255-5340. I hope you enjoyed this episode. We'll be back with you with our third of the week on Saturday. Enjoy the second half of your week and take care. Thanks for spending some time with me today.